Okay, welcome, Dr. Lindy here. I'd like to take a look at this other PowerPoint on the appendicular skeleton. So when we look at the appendicular skeleton, you'll see that when we look at the scapula from the posterior, we can see the spine of the scapula. When we look at it from the anterior, we don't. So this border here of the scapula is known as the medial border, aka vertebral border, because it's closest to the spinal column. And then this border, which is the lateral border, it's also known as the axillary border because it's closest to the axilla. Okay. So let's look at that shoulder girdle. Let me just see if there's anything to review here. Here's the manubrium. Here's the clavicle. Here's the acromion process. This is the sternoclavicular joint. This is the acromioclavicular joint. The medial 2/3 is convex, whereas the lateral 1/3 of the clavicle is concave. And when you find that concavity and we drop down, it takes us to the coracoid process. The coracoid process, which is here. That's the coracoid. So this is the AC joint, acromioclavicular joint, and that's the sternoclavicular joint. This is the sternal end. This is the acromial end. So we see here sternal end and acromial end. When we look at the scapula, we don't see a spine of the scapula, but this is the medial border. Once you find that glenoid fossa or glenoid cavity, that's where the head of the humerus is going to articulate. So this is the lateral part, whereas this is the medial part. So that's medial border. This is the lateral border, also known as the axillary border. Up on top is the superior border. We have a superior angle, we have an inferior angle, and then right here is the lateral angle. Here is the coracoid process. The coracoid process is the attachment for a few muscles. It's an attachment for the coracobrachialis. It's an attachment for the short head of the biceps, and its attachment for the pec minor muscle. This right here is the acromion process. Here's the glenoid cavity or glenoid fossa. This is the spine of the scapula right here. Spine, this should be spine, there's a little typo there. Spine of the scapula. Here's the superior border, medial border, lateral border, superior angle, and the inferior angle. Here are the fossas. Once you find the spine of the scapula, if you go above it, it's the supraspinous fossa, and when you go below it, infraspinous fossa. When you're on the anterior side, subscapular fossa. This is where the supraspinatus muscle originates, and here is where the infraspinatus muscle originates. Okay, those are two rotator cuff muscles. And on the subscapular fossa is where the subscapularis muscle originates. So those rotator cuff muscles are really called sits, S-I-T-S. This is the supraspinatus. This is the infraspinatus. This is teres minor, and that's the subscapularis. Those are the four muscles that are associated with stabilizing the shoulder joint. When we look at the humerus, here is the part that projects medially. That's the head. Greater tubercle, lesser tubercle, And then here is that bicipital groove. That bicipital groove is also known as the intertubercular groove. That's for the long head of the biceps that travels right through there. When we look at the distal end, remember I said you have to kind of figure out, are you looking at it from anterior or posterior? Once we see those two fosses, there are two fosses only found on the anterior side. On the posterior side, there's one. Okay. This large projection coming off is the medial epicondyle. We seem to get cut off there all the time. I don't know why. Okay, let's go back. Okay, so when we're looking at the, see if I can. When we're looking at the posterior humerus, the posterior humerus, remember, only has one fossa back here, and that's the olecranon fossa. You can see the medial epicondyle. Remember, that's the part that sticks out more. So even if you're not sure, find that medial epicondyle that sticks out significantly. That's where all the wrist flexors originate and some of the finger flexors. The lateral epicondyle is where the wrist extensors originate. And there's the olecranon fossa. Okay, now let's take a look at the ulna and the radius. Okay, let me bring my pen here. So this is a really nice picture because it's showing it from the lateral view. And when you look at the ulna from the lateral view, you can see that coronoid process better, and you can see this trochlear notch. So this coronoid process is going to articulate right here where the coronoid fossa is. And then here is the trochlea, and the trochlea is going to fit right here with the trochlear notch. So this kind of looks like a monkey wrench. If you kind of look at what a monkey wrench looks like, this is kind of like the appearance of it from the side view. Okay. On the posterior portion right there, that's the olecranon process. And here is the radial notch. So this is kind of like grooved, it's kind of contoured so that the head of the radius can fit perfectly there to allow for supination and pronation. Here's the olecranon process on the top. Here's the ulnar styloid. Here's that radial styloid. Here's the ulnar styloid. So here, this head of the radius is going to articulate beautifully with the radial notch. The radial notch is on the ulna. So that's the ulnar. This is the radius. At the distal end of the radius, right there, is the radial styloid. When we look at the hand, how do we tell if we're looking at it from the anterior or posterior? Well, on the anterior view, and only on the anterior, can we see the pisiform, which is that little pebble. That little carpal bone sits on top of the triquetrum, which is there. So again, it's the scaphoid, the lunate, triquetrum, and pisiform. Again, this is lateral. This is medial. We're going proximal row first, and then distal row. In the distal row, we have trapezium, trapezoid, capitate, and the hamate. The hamate also has a hook. So the hook of the hamate can only be seen on the anterior view. Distal to the carpals are the metacarpals. Again, we have metacarpal 1, 2, 3, 4, and 5. And then we have the phalanges. Digits 2, 3, 4, and 5 have a proximal, a middle, and a distal phalange. The thumb, or the pollex or pollicus, only has a proximal and a distal phalanx or phalange.